You're back with us on the Dr. Nandi Show, and it's quite possible the word biohacking brings crazy images to your mind, right? And you might not be wrong always. There are different types of biohacking, and one of them is grinder biohacking. It's where people called quote-unquote grinders try risky techniques like technology implants and extreme body modifications, things I really don't recommend at this time. So what are some hacks that overall I think are considered safe? With me now is integrative and functional medicine physician, my friend, Dr. Shelly Sethi. Thank you so much for coming.
Thank you for having me.
She's been here before, and she's going to tell us a little bit about hacking your body's physiology and biology to feel your best. So what do you consider, what's your definition of biohacking, Dr. Sethi?
I think that's such a great question because a lot of people define it differently. And for me, it's really about utilizing data and an awareness of your own body to be able to change your lifestyle so that you can optimize your health.
Yeah, so really knowing yourself so you can adapt accordingly, right?
Absolutely.
And you brought some methods to us, but you want to talk about something. I read about this that you're interested in, is Nootropics. What is that?
Yeah, so they are actually a collection of a variety of different substances. And most importantly, what they do is they work on the brain. So they enhance cognition, they help with focus and awareness, and they can also improve longevity and cognitive decline so that, you know, as you age, maybe you're not looking at something like dementia in the future. Which is huge. So it actually now we have over 80 substances that are defined as nootropics, and it can really be categorized as either more of the natural substances, which do include vitamins, herbs, amino acids, or more of the synthetic medications and prescription drugs that you hear about as well.
Pretty important because I think they're estimating that Alzheimer's, there'll be so many folks with Alzheimer's that the healthcare system can't keep up with it. So this is great. And you recommend which type? The one that are more natural, or the ones more synthetic, or a combination of both?
Yeah, I actually really do recommend the more natural types of nootropics. And so those might include things like herbs that have been around and utilized in Ayurvedic medicine, like bacopa, which is an enhancer of focus and memory. It might include things like ginseng, which a lot of people do know about, and we know that there are some studies now looking at cognitive decline, and the use of ginseng can really help with that as well.
And they've been used for such a long time. And these are things that are new to us, quote unquote, biohacking, but has been around for a long time for many cultures, right?
They have been around for a long time. The things that I don't recommend so much are drugs like Ritalin, Provigil, other drugs like that have their rightful place in medicine, but it's not really something that I would suggest somebody would want to try out for themselves. There are definitely side effects and concerns about addiction potential as well. And potential long-term effects as well. Lots of my patients who families have had, college students, high school students, they do that. Now you also have talked about an aura ring. Tell us about that. Absolutely. So this is what the aura ring looks like. And what's really incredible about this, I can put it on any finger, right? You can put it on any finger. My fingers are too fat. Please note that, but go ahead. Is that it has these unique sensors in it, which are actually measuring our pulse, measuring temperature and movement throughout the night. So this gives us a lot of information and tells us how we sleep. So most people don't realize they spend about 26 years of their life in sleep. So you can imagine how important sleep is. And if we're not getting good quality sleep, then we really aren't really effectively maximizing our benefits there. So this information tells us, it keeps track of your REM sleep, deep sleep, wakefulness periods as well. And what do you have here? So this is a heart rate variability monitor, which tracks the variability and rhythm of the heart. And what's really neat about this is that we can connect this, so you connect it to the earlobe there. And again, it's using some of those biometric sensors as well, just like we talked about with the Oura Ring. And then that actually collects data and it transmits it to an app that you might use on your smartphone. It's a good look for me too.
Absolutely.
So what happens with this is it utilizes biofeedback. And so as your heart rate gets to be in a more rhythmic pattern in what we call coherence, you start to notice that the patterns on your smartphone change. Maybe the color of the blue increases versus the red. And you can work on your breathing and your focus to actually affect your heart rate coherence, which then changes your emotional state.
And you've talked about meditation too. Do you have a hack for meditation as well, quote unquote?
100%, and that by far is my favorite hack.
Yes.
So the technology that I use is something called Muse, and it utilizes EEG technology, which actually measures brain waves.
Yes.
And then it connects to, again, a device, and you're able to listen to, let's say you pick the ocean. So as your brain waves get more stormy, let's say, the ocean gets more stormy.
Oh,
so
wow.
then you're directed in real time to focus again on your breath and begin to bring your focus back, and that ocean becomes calm and you begin to hear birds chirping. And again, over time, you change the neuroplasticity, or the way that your neurons are wired together in your brain, so you can change your overall state.
That's awesome. Great stuff, Dr. Sethi. I appreciate it.